Hi, today we will be interviewing Dr. Siri Yalamanchili, an ophthalmologist.
Okay, so first, could you introduce yourself and describe what your profession is or what your career is?
Sure. My name is Siri Yalamanchili. I am an ophthalmologist based in the Hopewell, Hamilton, and Doylestown areas. I actually just finished my training. So I did residency in ophthalmology. I did a fellowship in a subspecialty of ophthalmology called cornea, which is basically the front part of the eye. And now I started my first job out of training just in July. So
Nice. And you kind of like touched on it because you mentioned residency and stuff, but can you talk about your path to becoming an ophthalmologist?
yeah, sure. So any career in medicine begins obviously with med school after college. And after med school, once you decide what specialty you want to go into, you apply. And each specialty has different lengths of residency. So my residency was 4 years, 1 year called an intern year. So I did that year in internal medicine. And then I did 3 years in ophthalmology.
Okay.
So,
And then do you have to do additional years to like specialize in more stuff?
you can if you want to. Some people just go straight into practice right after residency. They do comprehensive ophthalmology, so they see everything. But there are fellowships that you can do, such as cornea, which is what I did, retina, which is the back of the eye, glaucoma, which is pretty much also the back of the eye. There's pediatric ophthalmology, there's neuro-ophthalmology, there's oculoplastics, which is basically around the eyelids and the orbit. So there's plenty of different options if you wanted to do a fellowship.
Okay. So what kind of things do you kind of deal with, and what might a day in your life look like?
Good question. So as a new ophthalmologist starting her job, right now I see pretty much anything that comes my way. The most basic thing could be just someone coming in for a diabetic exam. Every year, diabetics need to get checked since their eyes can get affected by the diabetes as well. So that's the most common or most routine patient that I see. And then there's also, more complicated patients, like patients that have, inflammation in their eyes or an infection in their eyes. In residency, I've seen a ton of traumas to the eye, firework injuries, ski accidents, you name it. So dealing with those patients and learning how to treat those patients is equally important just to build that foundation for, how to deal with those patients when you're on your own.
Yeah. What are like some of the procedures that you do on your patients?
The most common procedure that most ophthalmologists do out of training is cataract surgery. And now with the aging population, there's a lot of cataracts that come our way. So we do cataract surgery most commonly, and then it kind of depends on your subspecialty. Me being a cornea specialist, I do corneal transplants, and I'm working on getting certified in LASIK as well. So we do more of the front of the eye things. So corneal transplants, cataract surgery, any conjunctival procedures. The conjunctiva is basically the clear tissue on the white part of the eye. So anything with that as well, we operate on. And then retina surgeons, that's the back of the eye. They do retinal detachment repairs, different types of injections and lasers. So there's a lot of variety based on what kind of specialty you do.
That's really cool. Was there anything that like drew you into surgery? Or was there like any moment that kind of inspired you to enter this?
Yeah, so it was kind of a process throughout med school. In med school, it's tough because you get exposure to certain specialties more than others. And ophthalmology is one of those specialties where you don't get much exposure to in med school, unfortunately. So you have to kind of seek it out on your own and kind of find opportunities that, help you learn more about it and help you decide whether you want to do it or not. So I, shadowed, did research and everything. And I actually went into med school kind of thinking about ophthalmology already. My mom had LASIK way back when. So since then, my dad has actually he had been, telling me, oh, like you should check out ophthalmology when you go into med school. So I kind of had that in the back of my mind when I started. And then I really liked it. I've always been, into, the details of things. I've loved doing jewelry things like beadwork, crocheting, things like that growing up. So it kind of fit into my personality in that way, since ophthalmology involves a lot of fine details and microsurgery. So I really like that aspect. And ophthalmology in general, it's a really interesting field because it's such a small part of the body, but so many things can happen and so many, pathologies that you can see. And I really liked, the satisfaction that you can get from improving someone's vision. So
that's really nice. Were there any other subspecialties that you were considering before doing the cornea?
Yes, I was considering oculoplastics as well. The reason being is because I liked the procedures that they did in the office, like taking off little eyelid lesions or doing a blepharoplasty, meaning they remove the extra skin above the eyelid. And I liked the cosmetic aspect of it as well. I ultimately decided cornea because I still wanted to do cataract surgery. And if I did oculoplastics, usually you just do oculoplastics. You don't do cataract surgery or, things with the eye itself. You just kind of work around the eye. So I definitely wanted to do cataracts. So I ultimately decided cornea. And then maybe in the future, I'll be able to, have patients that come in for little eyelid lesions that I can still remove in clinic.
That's cool. Throughout your journey, what do you think the most important lessons are that you've learned through experiences with patients?
Good question. I think as people progress through their medical journey, they get exposed to a lot of different things. It's very stressful overall in certain ways, and it's really important. I've learned to find that work-life balance. Especially in med school. One of my best friends in med school actually was really good at finding work-life balance, and I've learned it from her to just kind of make time, set aside time for friends and family. You will miss certain important moments throughout your journey, but that's just the nature of it, and it's tough, but I think it's definitely rewarding. And once you get to the final stage of your journey and starting your job and your career, it'll definitely be, like a milestone that you reached.
Yeah, that's really nice. What did you think about your med school experience? Did you really like it? Did you think it was really tough?
Med school is tough, but that'll be anywhere that you go. I actually had kind of a unique path. I did a 6-year combined undergrad and med school program. So I had 2 years of college instead of the normal 4 years. And then I had 4 years of med school. So all of it was kind of fast-tracked a little bit. And looking back, I wish in some ways that I had more time in college to kind of explore other interests. But I mean, there's pros and cons. I also saved 2 years of tuition, 2 years of time, and now I'm one of the younger doctors, which is nice. But yeah, med school will be tough wherever you go. Especially the first 2 years are tough because it's just mainly lectures and books. But the 3rd and 4th years are better just because you'll be seeing patients, being in the hospital, interacting with people more. So I really enjoy it, especially my 4th year of med school.
Nice. What was like your favorite part of your whole like education, like undergrad and med school and residency? What was your favorite part or like favorite experience?
That is a good question. I think my favorite experience or I guess most significant moment would be there's a few of them, but one would be med school graduation. Definitely after 4 years of hard work, that was, a significant moment for me. And it was actually during COVID. We graduated in 2020. So that was kind of right when COVID started. So we had a remote graduation. And it was definitely not the graduation experience that we had hoped for or waited for, but it was special in its own way. And my parents were there, and we kind of were all on Zoom, and we put our med school hoods on. And yeah, it was a special moment.
That's really nice.
To be entering the workforce during that time. It was a crazy time, but it was memorable, and it was an experience. So
that's nice. What skills do you think are essential for someone in your career to have?
Yeah, so you mean in medicine or in ophthalmology?
In ophthalmology.
So ophthalmology, a lot of it you'll learn in residency. But I think just having an eye for small details and liking surgery, when you go through your 3rd year rotations, you'll know whether you like being in the OR or you like being in clinic. Ophthalmology has a mix of both. You usually have one day or 2 days per week in the OR, and then the rest of the week is clinic. So you get a nice mix of both. And if you like forming relationships with your patients and seeing them long term, there's certain specialties of ophthalmology that are fitting with that as well, especially glaucoma. Those patients are seen, throughout their life, and you do form a special relationship with them. And then in terms of surgery, definitely need to have the microsurgical skills. But like I said, you'll learn those during residency. That's kind of the purpose of residency, to help you learn those. So,
what do you think the most challenging part of your job is, and what do you think is the most rewarding part of your job?
I think the most challenging part would be, I guess, navigating different patient situations where, for example, if they can't afford a certain medication, or, certain social economic status, difficulties, making you, or help, you would need to, like, I guess, find an alternative, or, help them understand the situation, and learning how to talk to them through that. That's definitely something that you learn over time. One of the most rewarding things is, I think, seeing patients after cataract surgery. You see them, 1 day, 1 week post-op, and even by 1 week, they're already like, oh my gosh, like, I've never seen like this before. And it's just really nice to hear that.
Yeah, that's really nice. For someone interested in entering your career, what advice would you give them, and what do you think they could do to see if ophthalmology is like a good fit for them?
Good question. Yeah, so I would recommend that if you are at all thinking about ophthalmology or interested in learning more, to make the initiative to reach out to people like you did, and just kind of get their thoughts, their experience, and kind of find a mentor in someone, and shadowing them in clinic and even in the OR if you're able to, doing research with them, just kind of getting immersed in all of the things will really help you kind of find clarity in what you want to do. Ophthalmology is one of the tougher fields to match into out of med school, and it's getting tougher each year, unfortunately. But I think, taking the initiative ahead of time and finding those opportunities will really help you if you decide on doing it.
Okay. Thank you so much for the interview, and thank you for sharing
Of
all
course.
your experiences. Thank you.
Yeah, of course.